서울사이버대학을 다니고
나의 성공시대 시작됐다.
서울사이버대학을 다니고
나를 찾는 회사 많아졌다.
서울사이버대학을 다니고 내 인생이 달라졌다.
새로운 시대, 새로운 대학.
서울사이버대학교.
The first cyber university in Korea and largest independent intelligent campus. Today, SCU has established itself firmly as one of Korea's most foremost cyber universities. An automated e-learning studio equipped with broadcasting facilities, diversified and specialized education curriculums. With an investment of over $53 million on the e-learning system and its content, SCU is the first cyber university to make an online piano department. This department provides one-to-one on-offline lessons, and SCU offers the very best education infrastructure for students. The e-learning wave system that SCU has developed entirely on its own has been recognized for its excellence, winning awards from global authorities for the system itself as well as obtaining domestic patents. An integrated mobile service has been launched, allowing the signing up of courses and checking of assignments, offering an ideal learning environment for students. Based on cutting-edge educational system developed by SCU, the entire curriculum is conducted online. Seoul Cyber University students experience top-notch educational content online. At any time of day, students can access classes and can listen repeatedly to them. SCU enhances learning outcomes by one-on-one tutoring with a professor, submitting assignments online, and also taking all tests including midterm and final exams. Online studies provide a learning path to nourish a student's dream with no time and space limitation. Personalized service provides more choices for students in making decisions by one's preference from admission to graduation. Students can access the university from anywhere and at any time with any device. It is also possible to apply for BA, MA, or professional certificates and licenses. That university is Seoul Cyber University. SCU prides itself on the special lectures given all year round by renowned speakers, as well as SCU has its cutting-edge multimedia conference rooms where online lectures and seminars are held. SCU provides a one-stop student support services for military students. We also offer a system of diverse scholarships to over half of our student body. The highest level of student satisfaction starts with the best educational environment. SCU has a high readmission rate. The university itself is number 1 in terms of re-enrollment. SCU is university made for students. Seoul Cyber University was selected to manage the ASEAN Cyber University Establishment Project. Seoul Cyber University is now looking to expand globally with Vision 2026. Based on its cutting-edge learning system and infrastructure, SCU is reinventing the future of cyber education.
서울사이버대학교.
Seoul Cyber University.
Seoul Cyber University, a first-class university that is second to none.
(2021년에) 학생들이 가장 많이 입학한 학교가 어딘지 아시나요? 바로 서울사이버대학교입니다. 입학생 수뿐만 아니라 지원자 수도 가장 많았는데요. 그만큼 서울사이버대학교가 학생들 사이에서 인기가 있다는 겁니다. 왜 그렇게 많은 학생들이 지원하고 등록했는지 지금부터 그 이유를 알려드릴게요. 사이버대학교 선택 기준 어렵지 않아요. 고등교육법상 일반 종합대학교로서 정규 4년제 학사학위를 수여하는 서울사이버대학교는 2020년 교육부의 원격대학 역량진단평가에서 최고 등급인 A등급을 수상했는데요. 지금까지 교육부 공식평가가 2007년, 2013년, 2020년 총 3회 진행됐는데 이 모든 평가에서 최고 등급 A등급을 받았습니다. 박수! VX 시스템이라고 들어보셨나요? 서울사이버대학교가 자체 역량으로 개발하고 관련 기술을 특허 출원했는데요. 실감형 콘텐츠 제작 시스템, 즉 VX 시스템이 이러닝 서비스에 적용된 것은 세계 최초라고 합니다. 이 시스템은 하나의 대상을 다양한 각도에서 촬영하고 실시간 전송해 학습자가 여러 각도의 영상 중 하나를 직접 손쉽게 빠르게 선택할 수 있도록 하는 시스템입니다. 이 외에도 사이버대학 최대 규모, 최고 방송국 수준 스튜디오를 갖추고 있습니다. 사이버대학을 선택할 때 학생들이 가장 중요하게 생각하는 점이 무엇인지 아세요? 바로 자신이 공부하고 싶은 학과가 있는지 여부입니다. 2022학년도 모집 학과 및 전공이 총 41개로 사이버대 중에 가장 많습니다. 모집 정원도 가장 많고요. 학과 및 전공의 개설은 교육부가 허가해야 가능한 부분이어서 학교에 대한 신뢰가 없다면 당연히 허가가 나지 않습니다. 최다 모집학과, 최대 모집 정원이라는 것은 서울사이버대학교의 커리큘럼이 그만큼 뛰어나다는 것을 의미하는 거겠죠?
사이버대학교라고 캠퍼스가 없다? 아니죠. 사이버대학 중에 가장 많은 캠퍼스를 보유하고 있는 곳이 바로 서울사이버대학교입니다. 서울 본교뿐만이 아니라 전국 7개의 오프라인 캠퍼스를 가지고 있는 전국 최대 규모의 유일한 사이버대학교인데요. 다양한 오프라인 특강 및 강의, 학생 간담회, 선후배와의 교류, 캠퍼스 라이프를 꿈꾸는 여러분들 놓치지 마시길 바랍니다. 온라인으로 4년제 종합대학교 학사 취득이 가능한 건 기본, 1년 4학기 탄력학기제 운영, SCU 스마트 웨이브 4.0을 통해 시간, 장소의 제약 없이 수강과 출석이 가능합니다. 그리고 무려 3년 만에 빠른 졸업도 가능하다고 하는데요. 직장을 다니면서 졸업이 걱정인 분들 많으시죠? 졸업 시기를 여러분이 스스로 결정할 수 있다고 합니다. 믿어지시나요? 내가 원하면 누구보다 빠르게, 상황에 따라선 선택적으로 졸업 선택이 가능합니다. 학과 상관없이 모든 학생 다 누릴 수 있고요. 직장인이 선정한 사이버대학교 1위. 타이틀이 괜히 생긴 게 아니겠죠?
여러분, 우리가 생활하는 바로 지금 어떤 시대인지 아세요? 증기기관이 1차, 전기가 2차, 인터넷이 3차, 그리고 지금 4차 산업혁명의 시대입니다. 4차 산업혁명의 엄청난 기술들, 빅데이터, 인공지능, 로봇공학, 양자암호, 사물인터넷, 무인운송수단, 3D 프린팅, AR, VR 엄청 많죠. 이 중 가장 핵심인 인공지능, 로봇, 기계 이 세 가지 전문 교육이 서울사이버대학교에서 개설됐습니다. 박수! 기계 전문가 과정, 인공지능 제어 전문가 과정, 로봇 전문가 과정, 기계 응용 전문가 과정, 인간의 삶의 질을 향상할 수 있는 모든 4차 산업혁명의 기술을 배울 수 있답니다. 4차 산업혁명? 어렵지 않아요.
오프라인 캠퍼스가 가지는 특별한 장점, 바로 특강이죠. 국내외 유명 인사와 꿀맛 같은 특강이 수시로 열리는데요. 그중 오프라인 특강은 일반인도 참석 가능하다고 합니다. 저와 함께 가보실래요? 요즘 취업엔 자격증은 필수죠. 글로벌 자격관리센터에선 학과별 자격증 특강으로 취업에 필요한 자격증 취득에 도움을 드리고, 커리어 코칭센터에선 취업에 필요한 모든 것을 온라인으로 다 지원해드립니다.
대학생들의 대학생활 만족도가 엄청 높은 거 알고 계신가요? 바로 SCU 멘토링 때문인데요. 선배와 후배가 하나 되어 대학생활을 함께하는 서울사이버대학교만의 커리큘럼 4가지로 빠르게 정리해드릴게요. 첫째, 대학생활 정보 제공. 둘째, 온라인 학습 노하우 전수. 셋째, 온오프라인 만남 주도. 넷째, 조원들의 친문 관계 유지. 멘토와 함께 대학에 쉽게 적응할 수 있습니다. 멘토는 알려주기만 하냐? 아니죠. 멘토에겐 사회봉사 학점, 이은주 총장님 명의의 멘토링 인증서 발급의 혜택 등을 받을 수 있습니다. 서울사이버만의 특별한 인적 네트워크, 어서 경험해보세요.
캘리포니아 주립대, 러시아 하바롭스크대, 차이콥스키 음대 등 연수 기회 제공, 해외 각국 유명 교수들의 특별 강좌 운영까지. 여기 사이버대학교 맞나요? 이렇게까지 다 지원해주는데 학비가 비싸지 않을까 걱정이세요? 걱정 붙들어 매시길 바랍니다. 국내 사이버대학 중 교내 장학금 지급액 1위, 국내 최대 규모의 장학금 제도 서울사이버대학교의 자랑 아니겠습니까? 입학생, 재학생, 그리고 모두를 위한 국가장학금 제도까지 풍성한 장학제도로 학비 걱정 없이 공부하실 수 있습니다. 클래식하면 떠오르는 거장, 바로 차이콥스키. 전 그중에 피아노 협주곡 1번이 가장 인상 깊은데요. 빰빰 빰빰빰 할 때 그 전율, 그 이름을 딴 국제 콩쿠르가 바로 서울사이버대학교에서 열린다는 거 알고 있었나요? 17세 이하 전 세계 피아니스트들이 다 모인다고 하는데요. 이런 국제적인 콩쿠르가 가능한 이유는 사이버대학교 최초의 정통 클래식 피아노과 개설, 국내 최초의 해외 원격 피아노 교육 시스템, 차별화된 최상의 이론 및 실기 교육, 온라인으로 진행하고 있듯이 클래식 교육을 선도하고 있기 때문입니다.
저는 학창 생활하면 가장 기억에 남았던 게 동아리 활동인데요. 기타 치던 그 선배 진짜 멋졌는데 서울사이버대학교에는 수많은 동아리가 있습니다. 친목, 게임, 비즈니스, 종교, 자원봉사, 외국어 등 다양한 동아리 활동들이 있는데요. 다양한 경험을 하고 친목을 도모할 기회가 열려 있습니다. 제가 보기엔 일반 대학교보다 더 많은 것 같은데요. 사이버 대학교임에도 12년 동안 이어온 오랜 전통의 해외 문화 역사 탐방, 세계화에 맞춘 국제적인 시각은 물론 창의적이고 진취적인 태도를 갖추기 위한 프로그램이라고 하는데요. 호주, 캄보디아, 베트남, 블라디보스토크, 중국 서안, 타이페이, 싱가포르, 그리고 23번째로 대만까지 다녀왔다고 합니다. 저도 해외 활동 참 좋아하는데요. 저도 도전해보도록 하겠습니다.
캠퍼스 라이프 하면 어떤 게 떠오르시나요? 저는 MT가 떠오르는데요. 이것 보세요. 500명이나 참여하는 서울사이버대학교의 MT 스케일 실화인가요? 아직 놀라긴 일러요. 1000명 넘게 참석하는 축제도 빠지지 않는다고요. 500명, 1000명이 모이는 이곳은 바로 서울사이버대학교입니다.
자, 어떠세요? 여러분들이 너무나도 잘 알던 서울사이버대학교, 새로운 변화의 모습이 느껴지시나요? 이 정도면 전혀 몰랐던 매력에 푹 빠져들 수 있겠죠? 직접 와보시면 더 엄청나요. 보는 것만으로도 미래가 열리는 서울사이버대학교. 더 궁금하신 점은 요 아래 02-944-5000번으로 바로 전화주세요.
서울사이버대학교.
안녕하십니까 여러분. 지금부터 2022 SCU 국제사회복지세미나를 시작하겠습니다. 본교와 사회복지대학을 대신하여 이번 세미나 개회 선언을 할 수 있게 되어서 큰 영광으로 생각합니다. 저는 이번 세미나의 좌장을 맡은 서울사이버대학교 사회복지대학 학장 박태정 교수입니다. Good afternoon, everyone. I am Dr. Taejong Park, and I'm Dean of School of Social Welfare. It is a great honor and pleasure on behalf of our university to declare this seminar open. 세미나에 참석해 주신 모든 분들을 진심으로 환영합니다. 사실 올해 2022년이요. 저희 서울사이버대학교 사회복지대학이 설립된 지 20년이 되는 해입니다. 그래서 서울사이버대학교 사회복지대학 설립 20주년을 기념하고자 팬더믹과 사회복지라는 주제로 이번 세미나가 기획되었습니다. I'm delighted to welcome all of you. Actually, this year, 2022, marks the 20th anniversary of our department. For the commemorations of 20-year milestone, this seminar is planned and intended to address the impact on COVID-19 pandemic on social work. 그리고 세미나 시작하기에 앞서서 사실 정말 고마운 분들께 감사의 마음을 전하고 싶은데요. 무엇보다 스웨덴 스톡홀름 대학교 그리고 미국 캘리포니아 주립대학교 샘 버나디노 캠퍼스에서 학생들을 가르치고 계시는 사회복지학과 교수님들께 이 자리를 빌어서 다시 한번 감사드립니다. 이 가을 학기와 겨울 방학 이즈음이 굉장히 바쁜 시간인데 그 귀중한 시간을 할애하셔서 이번 세미나를 함께 준비해 주시고 협력해 주셔서 대단히 감사합니다. Well, I'd like to appreciate all professors from Stockholm University and California State University at San Bernardino. Actually, most professors are really busy in fall semester, including winter season, but they had taken their valuable time out from their tight schedule to prepare the seminar. 자, 그럼 먼저 서울사이버대학교 강인 총장님의 개회사가 있겠습니다. 지금 함께 이 세미나 참석하고 계시는 모든 분들 따뜻하게 저희 총장님을 맞아 주시기를 바랍니다. Now we'll have the opening address by President In Kang of Seoul Cyber University. Please welcome our president with a warm round of applause.
안녕하십니까. 2022 SCU 국제사회복지 세미나를 서울사이버대학교 사회복지대학 주관으로 개최하게 되어 매우 기쁘게 생각합니다. 먼저 본 국제 세미나에 참여해 주신 스톡홀름 대학교 타인 로스트가드 교수님, 캐롤라이나 어벌리언 교수님, 샘 버나디노 대학교 캐롤린 맥알리스터 교수님, 허버트 션 교수님, 제닌 메자 교수님, 그리고 서울사이버대학교 이은주 교수님께 감사를 드립니다. 또한 본 세미나를 개최하는 과정에 많은 애를 써주신 서울사이버대학교 사회복지대학 박태정 학장님 이하 모든 교수님께 감사를 드립니다. 최근 우리는 코로나 팬데믹 이후 4차 산업혁명 기술 혁신이 급속도로 확대되는 사회 변화 속에서 삶의 새로운 패러다임으로의 전환이 요구되어지고 있으며 사회복지 실천 현장에서도 코로나 팬데믹 이전과 다른 실천 방안을 제시할 필요가 제기되고 있습니다. 이러한 맥락에서 코비드-19 팬데믹과 사회복지에 관한 주제를 중심으로 장기요양, 가정폭력, 사회복지 종사자 및 정신건강 서비스 등에 관한 다양한 현안들을 논의하는 이 자리는 매우 의미 있는 시간이 되리라 생각합니다. 또한 본 국제 세미나를 통해서 코로나 팬데믹이 전 세계적으로 확산된 가운데 미국, 스웨덴, 한국에서 발생하는 각국의 변화된 사회복지 경험을 함께 공유함으로써 포스트 코로나 시대 국제사회에서의 사회복지에 관한 학문적, 실천적 함의를 도출할 수 있는 계기가 되기를 바랍니다. 끝으로 본 국제 세미나에 참석하신 사회복지 관계자 및 서울사이버대학교 학우 여러분들에게 감사를 드리며 이후 4차 산업혁명 시대에 적합한 사회복지 전문가로서 대처할 수 있는 다양한 방향성을 함께 모색하는 시간이 되기를 기대합니다. 감사합니다.
총장님 감사합니다. 자, 앞서 말씀드린 것처럼 이번 세미나에서는요, 팬더믹과 사회복지를 주제로 해서 한국, 미국, 스웨덴 이 3개 국가의 전문가들이 함께 발표를 하게 됩니다. 노인 돌봄과 장기 요양 부문, 그리고 가정폭력과 관련된 이슈, 정신건강과 관련된 여러 가지 사안들, 그리고 사회복지 종사자들이 이렇게 지금 코로나 상황에서 어떤 어려움과 또 어떤 고민을 하고 있는지 이러한 부분들을 주요 주제로 이번 세미나에서 발표될 예정입니다. 각 세션은 국가별로 구성되어 있습니다. 스웨덴, 미국, 한국 순서로 진행되고요. 이 세션이 모두 마무리가 된 이후에는 이번 세미나가 우리 한국 사회에 시사하는 바가 무엇인지 함께 살펴볼 수 있는 시사점과 마무리 토의 세션으로 진행이 될 예정입니다. Thank you very much. This seminar consists of 3 sessions and 1 wrap-up. Especially, we discuss various issues about surrounding long-term care, domestic violence, mental health service, and social workers. Of course, focusing on COVID-19. The professionals from Sweden, United States, and Korea gave us a meaningful presentation. 자, 개회식은 지금처럼 순차 통역으로 실시됩니다만 이후 모든 세미나의 발표 세션은 영어로 진행이 됩니다. 물론 이 영어로 진행되는 동안 실시간 한국어 동시 통역 자막을 보실 수 있음을 알려드립니다. 자, 그렇기 때문에 발표를 제외한 모든 진행은 한국어로 이루어진다는 점 다시 한번 공지해 드리겠습니다. We offer consecutive interpreting at the opening ceremony. All presentations will be held in English while the session will be conducted in Korean. Of course, you can see we provide the Korean subtitle for each presentation. 자, 그러면 지금부터 본격적으로 첫 번째 세션을 시작하겠습니다. 자, 첫 번째 세션은 스웨덴 스톡홀름 대학교에 계시는 타인 로스트가드 교수님께서 맡아주셨습니다. 지금 여러분들 보실 수 있는데요. 이 타인 로스트가드 교수님께서는 스톡홀름 대학교에서도 사회복지학과에서 중책을 맡고 계시지만 덴마크에 위치하고 있는 로스클레 대학교의 사회과학대학에서 특임 교수로도 또 역할을 하고 계시기도 합니다. 최근에 주로 연구하시는 분야는 노인 돌봄과 장기 요양 그리고 가족 정책 이러한 부분을 주제로 교육하고 연구하고 계십니다. 오늘 우리들에게 발표해 주실 주제는 바로 팬데믹이 장기 요양에 미친 영향에 관한 부분입니다. 자, 그러면 타인 로스트가드 교수님을 반갑게 맞아 주시기 바랍니다.
Hello, my name is Tine Rostgaard. I'm a professor at Stockholm University in Sweden. I would like to present to you a paper on long-term care for older people and COVID-19, where we look into the role of institutional factors. In my presentation, I will first present to you how long-term care has been affected by COVID-19, and here focusing on people residing in long-term care facilities. I will then also present to you 5 case countries, Denmark, England, Germany, Italy, and Spain, and present to you our results on whether institutional features of the long-term care systems may explain how they fared in the first wave of the pandemic. First of all, let me just shortly introduce to you the 5 case countries. One way of doing this is showing how much each country spends on long-term care. Here showing you the proportion of GDP and also per capita. So both showing you the share of GDP spent on long-term care, but also per person who is 65 and older in each country. And as you can see, Denmark is paying relatively more into long-term care than other countries. And we have the low spenders, if you can say that, which are the countries of Spain and Italy. And that is in regards to GDP and also per capita. Another way of looking at countries and presenting them in terms of the characteristics of long-term care is the proportion of older people, 65 and older, who are either receiving care at home or in an institution. And here there is some resemblance in the GDP investments and per capita investments also, because you can see that here again, Italy and Spain have a relatively low proportion of older people receiving care. Whereas you have countries like Germany with a higher proportion. In general, the care in institutions is more or less the same across countries. So where you find the main difference is often within care provided at home. In this presentation, from the OECD, there is England or UK is not part of it, but we know that around 3% of those who are 65 and older lived in care homes in 2018. We know of the pandemic that it hit mainly, or you can say predominantly, those who were over 65. So there is a risk, you can say, of catching COVID-19 if you are also old. And we know that the majority of deaths were also among older people. And across OECD countries, almost 95% of those who died due to COVID-19 were among people who were aged 60, actually. And if you look at those who were 85 or 80 and over, it was almost, or it was 58%. So being old could be considered as a risk in COVID-19 times. We also know that those living in or receiving long-term care were more at risk, and in particular those who were living in long-term care facilities. And that was both in terms of the spread of the disease and also in terms of mortality. And the reason for this is often said to be because these persons often have compromised immune systems or chronic conditions, and this places them in a high risk of infection. So we know across OECD countries about 40% of COVID-19 deaths were among long-term care facility residents. We also know that there is a strong association between overall mortality and the mortality that we can see in long-term care facilities. So this picture shows you the association between these two factors. And we know that COVID-19 long-term care deaths occurred mostly among residents in long-term care facilities. And we also know that the long-term care deaths in society were strongly associated with this. And this indicates that comprehensive measures taken on the general population level contributed very highly to protecting long-term care recipients and also long-term care workers. We also know, and this is seen more and more, that the pandemic carries with it a transformative power in that there is more attention paid these days to the necessity of investing in long-term care. So you can say that the pandemic brought new issues on the table, but also magnified long-standing challenges in the long-term care sector. This figure shows you an OECD questionnaire among OECD countries asking which are the most prominent areas of concern. And the survey here shows you that there's increasing attention to the need of investing in the sector, and also including looking at the long-term care budgets, training, and also the social rights associated. We do, however, see, even though that this is a common concern and an increasing concern, we do see high country variation in mortality in long-term care facilities. So overall, as already said, the share of long-term care deaths in total COVID-19 deaths was 40%, but there is high variation. And long-term care residents were more impacted than the rest of the population in some countries. So you can see the smallest proportion was found in Greece, and the highest proportion was found in Australia. It has to be said that there are huge problems of comparability of data, because the data quality is not the same across countries. But nevertheless, we can consider long-term care facilities as a critical case in which to view and assess the early COVID-19 policy responses and also the factors that conditioned it in regards to preparedness and also crisis management. And we can consider long-term care facilities as settings of care and accommodation for old and frail people. And in doing this, care homes, you can say, bring into focus the treatment of long-term care as a social risk and also expose the relationship between long-term care and health policy and provision. So we can consider the pandemic as an exogenous shock, but we can also say that it tested the preparedness, knowledge, and capacity utilization in the system, and very much exposed policy and practice priorities. So in the paper, we are asking whether institutional features explain the pandemic policies and outcomes. And we are making a comparison of 5 countries' policy approaches, taking to the virus in care homes in the first wave of the pandemic. And then we set this into the context of institutional policies. So the research question we ask in this paper is, if we look at the first 10 weeks of the pandemic, what was the timing and priority given to COVID-19 policies for care homes and compared to those for hospitals? And we also ask how we explain variation in policy across the 5 countries. There's also the source given to the paper if you would like to read it. It actually came out just today. It's important when making such a comparison to realize that the countries experienced the first COVID-19 case at different points of time. So what we do in the article is that we standardize the time frame and we estimate what were the policies from week 0. And this took place at different times across the countries. This is just to show you an example of the variation in when countries experienced the first case. So in Italy, it was February 17th, in Denmark, Germany, and Spain, it was February 24th, and in England, it was March 2nd. We have to say we recognize very much the very strong regional and even local dimension that there is to health and care policies and provision in the different countries. But in order to conduct a comparison for rigor and reach, we focus on the national level policies. It should also be said that we also know that even though there were national policies in place, whether they were implemented, we do not have information about. So presenting here to you the long-term care mortality, also relative to mortality in the general population, you can see that if we first look at the mortality among long-term care facility residents on the left side, that Denmark and Germany were relatively similar in having a relatively low mortality among residents during the first period, with higher rates in United Kingdom, Italy, and Spain. But if we then take into account how was the spread of the disease in societies as a whole, we can see that this levels out somewhat. But there is still some difference across the countries. But we can say that there might be explanations related to the pre-pandemic institutional features, but there is also both general regulation and specific long-term regulation during the pandemic, which explains this variation. What we do in the article is that we make a systematic comparison of key COVID-19 crisis policies in the 5 countries. And here we detail how, in turn, they approach and time lockdown of society as such, but also nursing homes, virus testing, and also how was the supply of personal protective equipment. And here we are considering nursing home facilities compared to hospitals. After this, we set this in context to key institutional features, which highlights the treatment or the location of long-term care homes within long-term care policy. And you can say this is something that predates the pandemic. And we look first of resourcing. So this is both in terms of GDP and also staff resources. We look at the degree of regulation. And we also look at vertical coordination across levels of governance and between the health and social care sectors. So you can say how the various systems work together. But if we first look at the crisis policies, we in the article look into whether there is a specific lockdown for care homes and in which week it was introduced. So we can see, for instance, Denmark and Germany had a specific lockdown for care homes in week 3 in both of these countries, whereas England had no specific lockdown, and in Italy, and also in Spain, whereas Italy only had a partial lockdown because visitors were allowed still. We also look into how long, when was the lockdown in care homes in comparison to the general lockdown of society. And we can see that in 3 of the countries it was at the same time. In Italy it was 1 week before, and also in Denmark. But in Denmark, it was a recommendation, but generally followed. And also we can see across most of the countries, it took place at the same time as the lockdown of the hospitals. So we conclude in terms of the lockdown policies that they were rather weak, in particular in England and Italy, not least because COVID-19 patients who were discharged from hospital were actually admitted to care homes to recover. And this was without providing a COVID-19 test, which was negative. So very often it happened that those people, those former patients, were actually infected care home residents. So we conclude that we find that Germany and Denmark have introduced precautionary measures regarding access and isolation early on, but in England, Italy, and Spain, care homes were not prioritized or well protected. We also look into the testing and monitoring. And again, we're looking into which week was the testing policy introduced into the country and whether care homes was explicitly targeted at this stage. And we find that England is lagging behind a bit. Germany in particular were targeting care homes. And there is some tendency that Denmark and Germany, at least, introduced it at the same time of the hospitals, testing in hospitals. So we find overall that there was a rationing of testing. So in England, Italy, and Spain, testing was heavily rationalized. And this meant, in effect, that it was a scarce good and supply was concentrated in hospitals. And this meant that the infection and mortality rates in care homes were actually hidden. So in terms of the policy of testing and monitoring, we conclude that except for Germany, testing was for a long time into the first wave of the pandemic, was viewed as a mitigation tool. And this was meaning that it was provided to patients with symptoms rather than for preventing purposes. So in contrast to a strategy of containment. And only in Denmark and Germany was testing in long-term care facilities prioritized on the same level as hospitals. Finally, we looked into personal protective equipment, and we looked into whether there was a specific policy for the supply of PPE in care homes and in which week it was introduced. And here we find that in Spain and England, there was a partly policy and introduced at different times, and also depending, it sometimes, most times, except for Germany, later than for hospitals. So here we conclude that England and Spain stand apart from the other 3 countries in that care homes were only partially targeted for PPE supply. But apart from Germany, we can also see that the countries gave priority to hospitals for PPE supply in the first week. So this was, hospitals were focused and not care homes. So overall, we find that some countries prioritize long-term care facilities on more or less equal footing with hospitals. And these countries are Germany and Denmark, whereas we have other countries that place long-term care facilities in a secondary position. And these countries were Italy, England, and Spain. So the question is, what may explain such variation in policy approach? And here we draw in some, shall we say, traditional institutional factors, which we think can then explain the variation in policy approach. First of all, we looked at resources, both human and material resources. And here, for instance, we can see in terms of GDP investments for long-term care expenditure, if we look at across the 5 countries and place them relative to each other, there is high GDP investments in Denmark and medium in England and Germany, but low in Italy and Spain. We also look at resources in terms of human resources. So the degree of professionalization in that we looked at the proportion of the workforce with health and or social care education. And here we find the same pattern in that Denmark has a high proportion of care force with professional background, whereas it's medium in Germany, but low in the other 3 countries. We also looked at long-term care regulation, and by this we mean national regulation, including the establishment of professional, structured, and quality standards. And here we find that Denmark and Germany stand out relative to the other countries in having high degree of regulation. And finally, we looked into coordination, where we find there's a high vertical multi-level coordination of long-term care in Denmark and Germany. Also high horizontal coordination of long-term care and health sectors. So there's an integration of health and social care, but only in Denmark. And then finally, we also looked at if we could see there was some association with the long-term care facility mortality into overall mortality rates. And here we can see that the common factors is that the countries which have a low long-term care facility mortality, Denmark and Germany, there is also some common features in that they have either come out either as high or medium on these particular institutional factors. So it's something about investments in terms of human and material resources. It's about long-term care facility regulation from a national level. And it's also about coordination. So we conclude in the chapter that the long-term care sector has been in particular hit by COVID-19 pandemic. And we find that there is some transformative power because there seems to be increasing attention to the sector and increasing in awareness, both in population and among policymakers, that there is a need for investing in the sector. Our analysis shows that there's variation in specific pre-pandemic systemic factors, and this includes the human and material resourcing, the degree of regulation and vertical coordination, and these seem to be part of the explanation for why we see the cross-national policy difference in the crisis policies. So we see that Denmark and Germany generally cohered in terms of adopting an approach that integrated the response to care homes into the national response, and including that for hospitals. So no difference, you can say, between hospitals and care homes. In England and Italy and Spain, on the other hand, there was a considerable policy delay or even inaction, and that downgraded the care homes in comparison to the resourcing and prioritization of hospitals for equipment and resources. And therefore, we can say that there was differential capacity to respond, and this may be located in systemic factors that predated the pandemic. We should also say that there seems to be policy learning. So we can see that in the second and now in the third wave of the pandemic, the 3 countries, England and Italy and Spain, have prioritized very differently and now prioritize care homes, including vaccine rollout. So we have learned very much from the first pandemic and seem to be doing things quite differently, fortunately, you can say. Here are some different sources which have been used for writing the article. And then I'll just say thank you very much.
타인 로스가드 교수님 대단히 감사드립니다. 저도 이 발표를 지금 같이 함께 실시간으로 경청을 하면서 일단 제가 좀 이렇게 열심히 들었던 부분들이 있는데요. 이 발표하신 말씀 중에서 어쨌든지 간에 코로나19 상황을 맞게 되면서 장기요양이라는 부문, 장기요양 시설, 장기요양 서비스에 대해서 이 국가들이 이 부분 굉장히 중요하구나. 우리가 여기에 굉장히 신경을 써야 하는구나 라는 이른바 아하 포인트를 갖게 되었다는 점, 이 말씀을 하실 때 우리나라도 마찬가지였고 마찬가지이다라는 부분에서도 저도 크게 공감을 했고요. 그리고 말미의 결론으로 지금 방금 말씀하셨습니다마는 팬데믹에 대응을 하는 정책을 잘 만들어서 뭔가가 잘 이렇게 위기로부터 안전하게 우리가 생활할 수 있고 문제를 해결했다라기보다는 물론 그런 부분도 있겠지만 기존 정책을 어떻게 써왔는지 우리가 사회복지 부문이랄지 또 뭐 구체적으로 노인 장기요양 이런 부분에 대해서 어떤 관점에서 접근했고 어떤 정책을 썼는지에 따라서 어떻게 보면 기존에 갖췄던 사회 안전망이겠지요. 거기에 따라서도 결국 이런 큰 어려움이 닥쳤을 때 위기에 대응하는 대처 능력은 차이가 날 수밖에 없다라는 부분, 그 결론에서 말씀하신 부분이 저는 개인적으로 참 굉장히 크게 어떤 면에 있어서는 아프게 공감되었습니다. 중요한 발표 내용 정말 감사드립니다. 자, 다음은 스톡홀름 대학교 캐롤라이나 웨블리언 교수님께서 발표하시겠습니다. 캐롤라이나 웨블리언 교수님께서는 스톡홀름 대학교에서 재직하시면서 사회복지대학에서 학생들을 가르치고 계시지만 동시에 노르웨이 오슬로에 있는 폭력과 트라우마 치료 연구소에서 이 연구 책임을 맡아서 중요한 연구들을 지금 수행하고 계십니다. 주로 연구하시는 분야는 이 가정폭력 피해 아동 청소년 그리고 아동복지 또 사회복지 실천 영역에 대해서 방점을 찍고 연구를 하고 계십니다. 자, 그러면 캐롤라이나 웨블리언 교수님을 반갑게 맞아 주시기 바랍니다.
Hi, everyone. My name is Carolyn Överlien. I'm a professor of social work at the Department of Social Work at Stockholm University, and I'm a research leader at the Norwegian Center for Violence and Traumatic Stress Studies in Norway, Oslo, Norway. I'm going to present today from a study that we did during spring of 2020, that is in the beginning of the pandemic, that will tell you a little bit about the situation in refugees, domestic violence refugees in Norway. So let me share the screen. There we are. So my presentation is called The Impact on the COVID-19 Pandemic on Social Work with Children and Adolescents Exposed to Domestic Violence. Some results from Swedish and Norwegian research. So in regards to social work, I will focus on refugees, domestic violence refugees and their situation during the pandemic. Okay. In response to the rapid worldwide spread of the coronavirus, Norway had a national lockdown. On March the 12th, 2020, I was sitting in a conference room at my research center when our director walked in and said that we had to leave the room right away and we had to leave our premises and go home. At the same time, my 17-year-old boy called me and said that he had to leave his high school right away. So we all knew that something very dramatic and rapid was happening in our country. And I would say that Norway had pretty strict measures during this first half year of the pandemic. All daycare centers and schools were closed immediately. That day, the 12th of March, many small businesses closed, that is like restaurants and shops and cafes, etc. And large gatherings such as concerts and games, etc. were banned. And many activities for children and adolescents were closed down, such as swimming pools, art centers, and football fields. The children of Oslo were actually not allowed to play football on the fields during the pandemic because of risks of spreading the virus. Children and adolescents were only allowed to play in small groups and preferably with the same kids every time. So they were not exposed to new children, but play in small groups in one of the children's homes. And services that are vital for children and adolescents' physical and mental health, such as school health services and community health clinics for children and adolescents, were also closed or had greatly reduced hours. And the child protection services in Norway reported reduced capacity due to employees' self-isolation efforts. And that has actually been one of the biggest challenges, that we've had such strict isolation rules on isolation that it was very difficult to run child protection services or schools or other services because there were just no staff there to run them. So that has been a great challenge. So this was the situation in March during that first month of the pandemic in Norway. At that time, we gathered everything, all the data that was out there on pandemics and different kinds of crises to learn and get some kind of idea of what that would mean to the groups that we are working for, and that is the children, that in my case, that is children and adolescents who live with violence and abuse, with child abuse and neglect. And one really valuable article or text was Peterman and colleagues. They published a paper, and this is one of their quotes. They wrote that the regional or global nature and associated fear and uncertainty of pandemics provide an enabling environment that may exacerbate or spark diverse forms of violence against women and children. And this study was a review of numerous scientific published articles, and they came to that conclusion that this was really a time for great risks of violence against women and children. But that was just that was based on other pandemics and other crises and catastrophes, not the COVID-19 that we were just starting to learn about. So, but we did have some knowledge, and that knowledge gave us some great reasons for concern for what was going to happen during the pandemic, the COVID-19 pandemic. And Peterman says that 3 of the direct and indirect causes of the link between pandemics and violence against women and children are these 3 links. There's economic instability that sort of is part of every pandemic. That is a great risk for women and children. An inability for women and children to escape the abuser because you are told to stay at home, you isolate. And of course, isolation is that's where aggression and violence sort of grows when you're isolated. And then there's the quarantine and social isolation from other parts of society. That means that there are very few that can sort of look into the family and see what's going on there and actually intervene and do something about it. So these are all sort of direct and indirect causes of this link between pandemics and violence. Again, that gave us great reason for concern and for worry. And then there were other really valuable texts from academics such as Marquez and colleagues. And they write that families with low socioeconomic status and who live in our overcrowded areas are particularly vulnerable. So that was also something to really keep in mind, that our areas where we have many people in lower socioeconomic status situations, that is really a great reason for concern about these groups, because they are particularly vulnerable for violence and abuse during a pandemic, such as the COVID-19 pandemic. Okay, I'm moving on to tell you something about domestic violence refugees in Norway. It is obligatory for all municipalities in Norway to provide refugees to their inhabitants. That also means that it is the municipalities who run and to finance all the refugees in Norway. And the people who work there are not volunteers, as they often are in other countries, but are actually paid for. They are staff and paid for by the municipalities. Norway is a small country, as you may know. We have about 7 million inhabitants. In 2020, there were 1,842 adults and 1,452 children and adolescents under the age of 18 who stayed 1 or more nights at a refuge in Norway. And I find these numbers really interesting, because that means that there are almost as many children as adults who stay who for a period of time live in shelters or refugees in Norway. And although the refugees are meant to be used for acute situations and short-term protection, children often stay for long periods of time. That is the reality, and there are many reasons for that. Housing, for example, the difficulties of finding housing, especially in the larger cities, means that many of these families are forced to stay for long periods of time in the shelters. And for children, of course, that can be a large part of their childhood, that they actually live in shelters or refugees. Okay, I'm now moving on to our specific study. So what we did was that we conducted a survey in April of 2020, and then T2 we conducted in June 2020. And we constructed the survey ourselves. We sent it out to all refugees in Norway, and that is 46 of them. The survey contained 15 items with fixed answers, follow-up questions, and an opportunity for the refugees to provide supplementary qualitative descriptions and examples. And I will, in this presentation, show you some of that complementary qualitative data. We had a 100% response rate, which is, of course, amazing. All 46 shelters responded and filled out the survey. As the survey was taken between the 8th and the 23rd of April in 2020, it covers the 4 to 6 weeks following the implementation of the government's strict, wide-ranging virus control measures. But then T2 was conducted in June 2020, and that was after a gradual opening of the Norwegian society. The questions that we were interested in finding answers to focused on 4 main topics: changes in the services due to the pandemic, the refugees' cooperation with other services, what the refugee staff saw as most worrying in the current situation, and what they saw as vital in order to be able to support the victims, and changes in the requests and motivations for contacting the refugees. This was what we, as researchers who have conducted many studies on children, on adults exposed to violence and abuse, but specifically also on shelters and refugees. These are the questions that we thought would be really, really valuable to get answers to during a crisis situation like during the spring of 2020. And some of these questions related specifically to children. And some general results then. Well, the majority of the respondents, of the 46 respondents, reported that it was too quiet out there, as one respondent said. It was just really, really quiet during the first phase of the shutdown of society. Very few contacted the refugees. It was a huge decrease of contacts compared to the year before. However, rates returned to normal when the strictest infection control measures were lifted. So in June, they were not completely quiet out there any longer. Much more, quite many women especially contacted the refugees in June. But in April, it was really, really quiet out there. Other results is that the respondents said that victims of domestic violence and abuse are not receiving the help and protection they need during the pandemic. This was a really great concern for the absolute majority of the respondents, that they would not receive the help. So they knew it was not quiet out there because nothing happened. They knew that it was actually the violence continued out in homes in Norway. However, they were not receiving the help and protection that they needed during those few first months. A third of the refugee staff reported on instances of the virus and/or infection control measures that were being used by perpetrators as part of the violence and coercive control strategies. So we found this really interesting. We asked the staff to tell us if the women who contacted them, they reported that the infection control measures were somehow used as a way to control and to isolate. And a third of them actually reported on this, such as someone who said, "I will infect you with the virus." Also creating their own corona rules. They were increasing isolation of the women in the homes, etc. So in fact, many many of the staff reported that indeed the women told them about the virus measures being used as a way to increase the violence and control and isolation in the homes. Some results regarding the children. The group, we asked, what group are you mostly concerned about? And actually 83% of the staff said that they are mostly concerned about children. And they were concerned about the children outside of the refuge, but also inside. So outside, they were concerned about the closed schools and what that would mean for children who live with violence at home. Then they had nowhere to turn to. And they were concerned about limited follow-up from the child protection services. Because everything was closed and families lived quite isolated, there were fewer adults who could support and report to the authorities if they suspected that a child were neglected or abused. So the children really had a weakened social network during these few months. Very few adults around them other than their parents or caregivers. But there were also worries that the presence of children in the home during the day increased the risk of violence and abuse, so that these families would experience increased stress. And one reason why they had increased stress was because the children were there all the time. And I should also add that many parents were expected to keep working from home. So they had to, still work and do what they were expected to do at work. But they were also expected to take care of children and to follow them up in school. And of course, this was a concern that this gave the families a lot of increased stress that in turn could lead to more violence. We believe that children who lived with violence before the pandemic are now even more exposed, and that the exposed parent is now even less able to protect the child, one staff reported to us. Another one said, vulnerable groups previously followed up with different parts of the social and health sector now have less contact and follow-up, hence fewer are keeping track. This also includes the children. So results continued. So they were concerned about the children outside of the shelter or refuge, but they were also concerned about the children who still lived inside of the refuge, because when everything is as normal, when it's not a pandemic, many refugees in Norway cooperate with different NGOs like Save the Children, and they actually come to the refugees and arrange activities for the children, and they help them with schoolwork, etc. And of course, all that was closed down during this first phase of the pandemic. Many refugees in Norway also have teachers who come in from nearby schools to help the children to be able to follow schooling while living at the shelter, and perhaps not being allowed, or that it's not possible because of security reasons, to leave. Then the teachers come from nearby schools to support the children and to help them follow the regular curricula in school. And of course, during the pandemic, there were no teachers that could visit the refuge, so no pedagogical contacts during this time. Also, the children were isolated in their rooms. They could not eat together with other families. They could only play with their family members. So they were really more or less stuck in their rooms. And of course, these are mothers in crisis, because they are forced to hide and to seek help in a refuge. So they are in crisis. And these mothers must then help with schoolwork. I mean, it was demanding for parents, I think, in general, to help their children with schoolwork while working at the same time from home. But of course, with these mothers that are in a very difficult situation, and many of them in crisis, it's even more challenging to help their children to be able to follow schoolwork. So one of the refugee staff says that it has been really demanding with all the children who have not gone to school but stayed at the refuge 24/7 with no alternative activities. Digital schooling and support from parents in crisis. We need more resources for those kids. Another one said, we ask everyone to spread out in the house as much as possible. The children only play with their family. They can't sit together with other children, watching TV, etc. All common meals at the center have stopped. They can't visit each other's rooms. We have to watch that they don't get physically too close. At the same time, it was very clear to us that these are services that are flexible and accustomed to crisis situations. 90% actually of the refugees reported that they had to adjust their organization to accommodate the government's new requirements while simultaneously fulfilling their obligation to provide support and shelter for victims of domestic violence and abuse. So they really had to adjust their organization. And it seems like they were really successful in doing that. We are educated, we keep calm, and we are highly trained to deal with challenging situations, one staff says. Our staff has stepped up in every possible way. So now concluding here, I think that domestic violence refugees have played a pivotal role in society during the COVID-19 pandemic and will continue to do so. And there's some implications here. There's increased awareness of the risk of prevalence of domestic violence and abuse accelerated by the pandemic. We really need to understand this now and prepare for this. And social work with families experiencing domestic violence and abuse, including DV refugees, must remain adaptive to the changing COVID-19 context and continue to develop innovating practice approaches. And here are some references. And with that, I thank you for listening, and please get back to me if you have any questions, and I would, of course, love to answer any questions you might have. Thank you for listening.
네, 캐롤라이나 어블리언 교수님 정말 발표 잘 들었습니다. 제가 교수님 발표를 들으면서 아마 여러분들께서도 몇 가지 중요한 단어들을 보셨을 건데요. 의미 있는 단어들을 보셨을 건데요. 저는 매번 같은 친구를 만났어야 됐다라는 그런 부분들, 사실 다양한 친구, 다양한 모임, 다양한 활동을 통해서 우리 아이와 청소년들이 사회성을 더 높일 수 있고 사회적 자본을 만들어 나가는 그러한 시기임에도 불구하고 이 코로나라는 것이 이런 부분을 굉장히 많이 갉아먹었겠구나라는 생각을 했고요. 무엇보다 여성, 아동, 청소년, 물론 이 부분에서는 이 세 가지 대상을 주로 들여다보고 있습니다만은 사실 뭐 노인도 마찬가지일 것이고요. 이런 여러 가지 폭력이라는 위험에 노출되어 있는 분들이 제3자의 어떤 기구나 기관을 통한 개입과 여러 가지 보호와 이런 장치가 필요함에도 불구하고 팬데믹 상황은 이런 부분들이 원활하게 작동하는 데 있어서 굉장히 큰 어려움을 주었다라는 점에서 공감을 했던 부분이기도 합니다. 물론 이러한 것들을 사실 우리가 2년 동안 이제 거의 이제 3년에 접어드는데요. 이제 겪으면서 조금 더 성장할 수 있는, 어떻게 보면 우리가 아픈 만큼 성숙해진다는 얘기를 하죠. 이제 그런 부분에서 발전적인 모습으로도 나갈 수 있다는 부분에서는 저도 교수님 의견과 마찬가지로 좀 공감할 수 있는, 그나마 우리가 얻을 수 있었던 교훈일 것이다 라고 공감을 했습니다. 교수님 발표 대단히 잘 들었습니다. 감사합니다. 자, 여기까지가 스웨덴 세션이었고요. 이제 지금은 여러분들 보시는 것처럼 미국 세션으로 이제 넘어왔습니다. 미국 세션은 바로 캘리포니아 주립대학교 샘 버나디노 캠퍼스의 사회복지대학 교수님들께서 공동 발표를 준비하셨습니다. 캐롤린 맥칼리스터 교수님, 허버트 션 교수님, 그리고 제니 메자 교수님께서 오늘 여러분들 보시는 것처럼 이제 그룹 발표를 준비하셨는데요. 세 분 교수님이 오늘 같이 발표하실 내용은 바로 사회복지 종사자를 둘러싸고 과연 이 팬데믹이 어떤 문제, 어떤 고민거리를 던져주었는지에 대한 부분입니다. 사회복지사도 마찬가지고 또 사회복지 인턴십 그리고 사회복지 교육이라는 부분을 좀 전체적으로 조망하면서 우리들에게 말씀을 해주실 건데요. 이 세 분 교수님에 대해서 제가 간략하게 소개를 해드리겠습니다. 먼저 캐롤린 맥칼리스터 교수님께서는 샘 버나디노 대학 사회복지대학에서 학장을 맡고 계시고요. 사회복지 실천과 연구 방법 분야에서 중요한 주제를 다루시면서 교육하고 연구하고 계십니다. 그리고 여기 가운데 보이는 허버트 션 교수님께서는 노년학과, 호스피스, 그리고 보건복지 정책 부문에 있어서 조금 더 중요한 토픽을 잡으셔서 연구하고 교육을 진행하고 계십니다. 마지막으로 제 바로 옆에 보이는 메자 교수님께서는 아동복지와 청소년 복지 그리고 학교사회복지라는 부문을 중요한 주제로 잡아서 활발하게 연구하고 교육을 하고 계십니다. 자, 그러면 세 분 교수님께서 발표하시게 되는 내용에 대해서 여러분들도 함께 한번 고민하시고 생각해보는 계기를 맞기를 바랍니다. 반갑게 맞아주시기 바랍니다.
Welcome. I'm Dr. Carolyn McAllister, and with me is Dr. Herbert Shon and Ms. Jeannine Meza. And today we're going to be covering California's social work workforce issues in COVID-19. Like other essential services, social workers worldwide found themselves required to provide services throughout the COVID-19 pandemic through rapidly changing situations, changes to policies and procedures, and to some of the most vulnerable populations in the world. In this presentation, we'll focus on the impacts of COVID-19 on social work practice and the education of social workers in California. We'll talk about this from a chronological standpoint using the timeframes that we have listed on this slide. Spring term 2020, July 2020 through March 2021, March 2021 through December, or current, and then our future predictions. We're going to be talking about this from our perspectives. For myself, I am the director of our School of Social Work. So I've been in lots of conversations with agencies statewide about the issues that they've been facing. Dr. Shon and Ms. Meza both work in our internship programs as field coordinators. And as such, they have really good insights into the day-to-day issues that we faced with our interns throughout this pandemic. California's governor, Gavin Newsom, declared a state of emergency due to COVID-19 on March 4th, 2020. So at this point, the state of California started moving towards a process of determining more and more people needed to stay at home due to the pandemic. And it accumulated with Executive Order N3320, which mandated that we stay in our homes except for essential services. And we started that on March 19th, 2020. The order allowed for a set of vital services and organizations to remain open and for those employees to remain working on site. And this included vital social service agencies such as medical facilities, child welfare agencies, adult protective services, mental health services, food distribution centers, and services to homeless populations. From an agency perspective, most initial agency responses were to put as many of their social services and social workers to work in a virtual format, if at all possible. With little known about the virus and its transmission, and very little personal protective gear available, many agencies were concerned about the safety of their employees and their clients. On the other hand, county agency workers, particularly in the areas of child welfare, homeless services, and adult protective services, found themselves continuing to have to go out into the workplace at least some of the time to do home visits, to do assessments, and to make recommendations for treatment. In addition, some counties, especially some very large public counties, required employees in these public county agencies to work more towards emergency response. And that might have been included things like homeless services or other kind of crisis response services. And many of these workers were not used to this kind of service. Virtually all social work programs statewide, like CSUSB, determined that the only safe solution for social work interns at this point was to keep them all at home. We had no idea about the transmission of COVID-19. We didn't understand how communicable it was. And social work interns, by definition, are not essential employees. Social work programs followed our Council on Social Work Education, our accreditation body's lead on how to navigate this pandemic. They allowed us to do some reduction of field hours in order to have students graduate successfully with less hours. Many students coming into spring term or around March of 2020, April of 2020, actually had almost enough internship hours to complete those minimum hours by CSWE standards. What many programs did is they allowed us to find other ways to provide hours. So some agencies worked with us to identify virtual opportunities for student interns to continue to work. The other thing we did is we found intentionally internship support and modules, online modules that we created to offer more learning during this time. We did offer lots of additional supervision and support as internships, but we certainly were concerned about how this was going to impact our students. By March 2020, many interns are at the point where they're doing their most independent work. And unfortunately, they lost out on that period of time. You're muted, Herb.
As initial case numbers of COVID-19 began to decline through the summer of 2020, masks and other personal protective equipment became available and technological solutions became more available. Programs across the state of California began to move in very disparate ways. Many schools determined that they should remain offering services at a distance, including all public universities in the state of California. Excuse me, and many outpatient mental health clinics and programs offered telehealth opportunities. Other organizations moved to bring back in-person services, including CDC and state of California guidelines to do so. Agencies made adjustments over the course of these months, and many moved to offer at least limited in-person services. As personal protective equipment became more readily available, most agencies had social workers come into work at least part-time. For example, school social workers may have held virtual sessions with students, but often worked out of their school offices. Organizations also worked to provide adequate social services, but limitations existed. Due to the multiple variables at play, agencies were overwhelmed by having to decide how to respond to client and employee needs, including interns' needs. Agencies were somewhat reluctant to accept interns for the 2021 to 22 academic year because there were still many unknown factors associated with the pandemic and its duration. And we were still unsure about best practices for mitigating transmission in the workplace environment. Some agencies were also concerned to supervise interns in remote field work or provide concurrent plans if interns needed alternative hours due to contracting COVID or needing to be quarantined. Some agencies that normally accepted several interns for the academic year instead only accepted 1 or 2 students due to the strain on agency resources and the need to ensure social distancing. This created a hardship on current agency employees as well as contributed to a bottlenecking in the workforce preparation. This year, the majority of placements were virtual or a hybrid of virtual and in-person. Social welfare and medical agencies, generally speaking, were mainly in-person, reflecting the essential nature of these services, while also ensuring social distancing, mask wearing, and frequent hand washing and sanitization. Most other field placements, however, were either totally virtual or had interns report to their offices due to HIPAA concerns and work virtually or in person with clients while practicing the same COVID-19 safety precautions. In a survey conducted by the Council on Social Education in 2020 on student perceptions of the impact of COVID-19 on their educational experiences, 81% of them indicated that the pandemic had negatively impacted their mental health. The pandemic has impacted students' learning and demonstration of the 9 core competencies that students are required to demonstrate in their social work education. And social work programs have had to provide support to service to students to facilitate their academic success and professional well-being. An additional excuse me, an additional concern was with some field placements moving to solely remote work, thereby leaving a few further gap in the student learning, immersion, support, and integration into the profession. Noriega in 2021 found statistically significant differences in a sample of 89 MSW students pre and current pandemic scores at a large public Southern California university on several measures that included life satisfaction, self-care, perceived academic stress, friendship isolation, and resilience. Similarly, in 2021, Davis and Mirek surveyed BASW and MSW students to assess how the pandemic affected their field experiences. There's a wide range of field experience choices that were afforded to the students, either by their social work programs and or their agencies. In some situations, the students were given the choice of deciding for themselves. For example, they were able to continue in a field placement if they felt comfortable about doing so. And I would also imagine that if the student also did not have a pre-existing condition that made them further at risk of contracting the virus. Another condition was they could continue their field placement if the field placement remained open. As we know, we actually lost a couple of agencies as well in our own catchment area due to COVID and not being able to sustain itself. The respondents were also asked if services were provided remotely and if they received training for delivering services remotely. And a good number of them actually reported that they did not receive adequate training on how to provide services to clients remotely, and that caused them additional stress at their field placement. 23% of the students identified barriers to working remotely as well, such as technological issues, some services not being well adapted to working remotely, and also insufficient supervision. So there were various challenges that these students have identified in working remotely at their clinics or actually from home. There were, however, some situations in which a good number of students reported that there were some positives that they gleaned from working remotely. And these include the need for social workers to be adaptable, flexible, and calm, new ways to provide services such as through telehealth, the importance of planning and being prepared, such as having a backup plan for emergencies and unexpected crises, and new perspectives on practice, such as disease prevention and the unpredictability of social work practice. The other last finding was that students had realizations about themselves, such as the importance of implementing self-care measures into their lives, and the importance of generosity and empathy toward others, and as well systematic issues that were exposed by the pandemic, such as the increased risk that it placed on vulnerable populations.
Now we'll transition to discussing the move to bring services back to an in-person format in the time period of April 21 to December 2021. During this time, the state of California had a tiered response to vaccination, and social workers in most counties were luckily identified as high priority. As social workers became vaccinated, agencies worked to increase the number of in-person services available. However, this led to unexpected concerns and issues from both agencies and universities. The first concern relates to the decisions that social workers have made about how they work. Social work agencies statewide during the pandemic hired employees that worked at a distance from the office or hired employees that had limited to no in-person work with the agency. As agencies required social workers return to the office, some employees chose to leave their positions or requested more flexible work schedules. Agencies have found it increasingly difficult to hire and retain new social workers, specifically social workers of color, Rural counties in particular have found it incredibly difficult to hire and retain social workers, as employees have taken virtual positions for higher pay or go to work in social service agencies that have higher rates of compensation. Another key issue has been vaccination. While many Americans have chosen to vaccinate and vaccines are now readily available, a significant proportion have chosen not to vaccinate. As of December 2021, this month currently, depending on the resource used, between 66%, according to the LA Times, using the CDC data, the Center for Disease Control, to 70.3%, a statistic cited by the California Department of Public Health, of Californians are fully vaccinated. However, the percent ranges greatly depending on factors such as county, ethnicity, age, and other factors. For example, the LA Times, using the US Center for Disease Control webpage, finds that only 29.9% of the population of Lassen County, California, is fully vaccinated, compared to 89.7% of the population of Marin County, California. Each county, school district, or private agency has determined their own vaccination requirements, leading social workers who do not want to vaccinate or social workers that do not want to work with unvaccinated populations, making employment decisions based on this factor alone. Due to the need for students and agencies to be in person, yet students still being exposed to or having COVID-19, there has been significant disruption of students attending both classes and internships. We had a number of students who were ready to start social work programs, but decided not to at the last minute due to COVID-19 related issues, such as illness or loss in their own families, childcare issues, vaccination issues, and significant financial issues. Nearly all of our internships are back to in person, with almost no agencies offering virtual options. Students who had virtual internships in the previous academic year of 2019-2020 and 2020-2021 presented as less confident and less prepared in this academic year. An overall sense of fatigue presents itself in both students and faculty alike, as the ongoing pressures of maintaining health and navigating pandemic life persist. In response to the concerns presented by students, field programs across the state have added in additional resources on topics such as addressing and managing self-care in a professional context, compassion fatigue, burnout, and setting good boundaries in social work. Social work educational programs are continuing to offer additional support to students through supplemental weekly supervision and training opportunities for students to build their social work knowledge, skills, and values.
Now we're going to try to look towards the future. And as you know, things change every day. So we're going to report, first of all, a little bit about the new variant, Omicron. And we suspect, and some research demonstrates, that it has increased transmissibility of a factor of 4 compared to the Delta variant, which we already knew was highly transmissible. We have very open questions about how agencies will continue to serve our vulnerable populations. Another factor is that it appears that our vaccines are not as effective against Omicron as they were other variants of COVID-19. Research has demonstrated that virtual operations during COVID-19 have been disproportionately harmful to vulnerable populations, such as persons with disabilities, homeless populations, persons with underlying mental health conditions, people in poverty, people in rural populations, and minority populations. Internet accessibility remains a significant problem for many rural and poor communities, And until there are good long-term solutions, we will continue to struggle to provide sufficient and appropriate services to our most vulnerable.
Across the state, agency administrators are requesting an increase in social work workforce and increased diversity in social workers hired. To the extent possible, agency administrators are requesting that agencies offer more flexibility in scheduling and virtual work to attract a larger workforce. On the other hand, most agencies find themselves being pushed to offer services at the level commensurate to pre-pandemic levels and assigning higher caseloads and having higher expectations of employees. Social work programs statewide are being asked to build capacity for students. There are a number of potential concerns regarding this request, particularly in terms of finding appropriate internships for students. The National Association of Social Workers, California chapter, is working to request increased budget from the state of California to increase workforce capacity, which may offer some opportunities to further grow social work programs. Social work programs continue to have challenges with successful placement and retention of social work students. A number of students determined to take leave of absence or to not begin their program because of concerns regarding vaccines, financial, and personal issues. Students are torn between wanting in-person classes or the relative convenience and safety of online classes. Issues with students choosing not to start college due to not wanting to be online. Other students want classes to remain online. The pandemic has provided a window of opportunity for social work programs to assess and evaluate their curriculum and partner with agencies to better prepare social work students for the workforce. In a survey of 717 social workers in California, Ohio, and New York, California social workers reported feeling less prepared to work with dual diagnosis clients and felt more comfortable working with clients with alcohol use issues rather than cannabis use issues. Critical race theory must be infused throughout the curriculum so that students understand what oppression, marginalization, and systemic racism are and how that impacts and informs their practice with clients. Social work programs are thus working to develop and consider new coursework in the areas of diversity, equity, and inclusion, and disaster social work and substance abuse treatment. Programs are also exploring the use of virtual simulation experiences, like the program SIMPACT, to supplement student learning about diverse populations and settings. At the time of this writing of the paper, 7 of the 9 University of California campuses announced that starting in 2022, they will temporarily offer remote-only classes due to the significant escalation in numbers of Omicron cases. Similarly, the University of Southern California, USC, has announced that it is likely to require booster shots in the spring 2022 semester, and that although they are not planning to go online as of December 20, 2021, they are closely monitoring changing conditions and, like many other universities, are considering temporary remote start to their spring 2022 semester. And as the writing of this paper, the California State Universities will require all students, faculty, and staff to receive booster shots by February 28th, 2022.
COVID-19. Oh, go ahead.
I'm sorry.
COVID-19 forced rapid and significant changes to both social work practice and social work education worldwide. The changes made during the 2020-2021 period have long-term implications for social services and social work practice, as well as for social work education. The ability to offer virtual services is a significant strength and addition, but these types of services leave some client populations more vulnerable. The changes also brought about changes in the social work workforce, where social workers may make decisions to work virtually or in more flexible work environments, and may move away from rural areas. Social work education has been tasked to become more flexible, and we're currently being pushed by agencies to increase the number of qualified graduates. We will expect to see continued changes in all areas of social work practice and education in the near future.
Thank you very much for listening into our presentation. We wanted to review briefly the references that we used to write this manuscript and put together this presentation. We invite you to send us an email. We are all on the CSUSB School of Social Work website, and you are welcome to reach out to us if you have questions about our presentation. We really thank the Cyber University of Seoul for allowing us to participate in this event, and we hope that you got some additional information about how we have operated under COVID-19 conditions in California, and hopefully it can help relate to how things have been happening in Korea and in other countries. Thank you very much, and I hope you have a great day.
세 분 교수님 발표 정말 잘 들었습니다. 좋은 발표해 주셔서 감사드립니다. 사실 사회복지대학에서 교수로서 또 연구자로서 종사하고 있기 때문에 다른 발표도 굉장히 제가 인상 깊게 듣고 있습니다만 이번 발표 역시도 과연 우리 사회복지 교육이 이런 팬더믹과 같은 위기 상황 속에서 어떠한 내용을 좀 더 보완하고 보강하고 또 교육에 있어서 어떠한 구심점을 가져가야 될 것인가 라는 부분을 둘러싸고 저도 많은 고민을 했던 시간이었습니다. 아마 여러분들께서도 같은 고민을 하고 계시리라 생각이 됩니다. 자, 지금까지 미국 세션 모두 마무리가 되었습니다. 다음 세션은 바로 우리나라 대한민국 상황에 대한 부분입니다. 한국 상황에 대한 부분은 다름 아닌 저희 학교 사회복지대학 이은주 교수님과 정현주 교수님께서 같이 공동 연구한 내용을 오늘 발표에서는 이은주 교수님께서 발표해 주시겠습니다. 발표해 주실 내용은 코로나19와 정신건강 서비스에 대한 내용입니다. 아마 이 정신질환, 정신건강 분야에 관심을 두고 있는 분들이 이번에 신청하신 분들 가운데서도 많이 있는 걸로 알고 있는데요. 조금 더 관심을 가지고 집중해서 들어주시기 바랍니다. 반갑게 맞아 주십시오.
Hello everyone, I'm Unju Lee, teaching in Seoul Cyber University. Today I'd like to talk about mental health services during the pandemic in Korea. Today's presentation was prepared with Dr. Hyunju Jung, professor of School of Social Welfare in Seoul Cyber University. And it's a great honor to present at the International Symposium where professors from Sweden, United States, and Korea participate. I would like to thank professors in Stockholm University, Sweden, and professors California State University of US, and for their previous presentation. I also express my deepest gratitude to Dr. In Gang, President of Seoul Cyber University, Dr. Taejong Park, Dean of School of Social Welfare, Seoul Cyber University, and staffs for holding today's symposium. Globally, the pandemic had a profound impact on individuals' daily and social lives from the 2020. Today, I would like to show the impact of COVID-19 on people with mental disorder compared to period 21 to 2021. My presentation consists of introduction, research background, research method, and research results and conclusion. As we know, disaster of COVID-19 affected unequally and disproportionately according to age, income, social status, and occupational characteristics have a great negative impact on socially vulnerable. And the lower income and social status and the more experienced wage cut and job loss and the more negative result on physical mental health. In this situation, we like to understand experience of people with mental health problems who participated in the Dublin Project to improve awareness of mental disorder and response of mental health welfare services center during COVID-19. Actually, you might be very curious about Dublin Project. Dublin Project is a program in which mentally disabled go through the voice sector education and then training to produce animation dubbed videos and use them as educational material for awareness improvement and go to the street to campaign for the people with mental problems. Let's take a look at the COVID-19 and mental health services in Korea. How the COVID-19 affected the field of mental health social welfare practice. Actually, because of COVID-19, social welfare practice in the area of mental health in Korea greatly affected, and the impact is continuing. And then the number of cases experiencing depression, helplessness has increased and has become great risk factor people with poor mental health. As the community mental rehabilitation services stopped, their daily life of mentally disabled and their health actually deteriorated. The risk of recurrence increased due to social distancing and service interruption, such as social isolation, increased stress, and decreased emotional expressions. Daily life and social environment of mentally disabled was lost. Health status deteriorated due to decreased physical activity and negative emotion were increased. Because of the COVID-19, the mental health welfare practice in Korea very negatively affected. So their alternative was to the change rapid tradition of service to online-based and community-oriented. This is reported by Korea Clubhouse Association in 2020. Some of the measures included maintenance of existing services and provide clear response guidelines and self-check through application development and linkage with institutional services and operation of online program, YouTube, emergency care services, and volunteering outside such as hairdressing service. Support activities during the weekly rehabilitation period and education according to change due to external circumstances, support activities for daily life and self-management. In this here, I like to show according to different facilities, how they provided the services or stopped the services. Because of closing and service suspension, they adopted various non-face-to-face conversions. In the daytime facilities, most the facilities closed, emergency care only provided, and most services suspended. Because of closing, stopping the service affected the huge pain for users and their families. At the living facilities, comprehensive provision of all services provided, but they provide very minimal service. They stopped vocational training education. At the vocational rehabilitation facilities, service provision was very unclear. Vocational training placement provided only one-to-one basis. Other services not provided. So to summarize, at the mental health welfare services, they tried to variety of non-face-to-face services, including utilization of online technology and daytime activities of video conferencing, chatting, live broadcasting, and switching to SNS activities, video calls, and maintaining personal encounters outdoors and strengthening home visits. So rather than let users come to the center or institution, the staff members and the social workers more like to visit users' home and then do more outdoor activities. So their expansion to the non-face-to-face services, providing non-face-to-face services such as minimal contact, phone consultation, text message, online consultation, video call, and then emergency supplies, provided daily necessities and hygiene products, quarantine products. And then the plan and run program, including distribution of meal kit and the inspection of guides and workbook related to independent living, and transition to Untech program using YouTube. So very rapid transition to the variety of non-face-to-face services provided in Korea. Here, I'd like to introduce the Dubbing Project again. More specifically, Dubbing Project is to support recovery of mentally disabled, produce UCC, and improve community awareness. Dubbing Project has 4 the contents. First, support recovery, empowerment of the people with mental problems, activation of self-help groups, and then mental disorder awareness improvement education, and UCC production and campaign. This project conducted for 3 years, from 2019 to 2020, at E-Mental Rehabilitation Facility located in UCT, Gyeonggi-do, and has 4 goals. First, improve interpersonal relationship with mentally disabled, improve recovery ability. So this one related to performing at the dubbing class. Inspire sense of solidarity and achievement among participants. This is related to self-help group work and the improvement of human rights sensibility of the participants. They provide human rights education and promoting awareness improvement in local community. This is related to community activities for improving awareness. So the characteristic of Dubbing Project has 2 main the contents: promotion of communication, interpersonal relationship through Dubbing Project of the users, and then user-led community mental disorder awareness improvement activities. The research method used in this the study was qualitative research based on in-depth interviews. The qualitative research is useful to explore or understand the life experience of research participants and the context surrounding the experience. A total 10 people participated in the Dubbing Project activities from beginning to end after being selected by audition. They very excited because they selected by audition. It's a kind of a competition, the winners. We conducted 2 the in-depth interviews in August 2020 and August 21. August 2020, because of severe COVID-19, 10 participants interviewed through using Google Meet, online in-depth interview. In 2021, with the corona policy of the government, we conducted a face-to-face interview with 6 people and 2 people with the online in-depth interviews. And also in 2021, we added the online in-depth interview with 3 mental health experts. Interview were conducted individually for 1 hour and 1 hour and 30 minutes. All interviews were recorded with the consent of participants, and IRB examination of 서울사이버 University passed. Here the characteristic of a research participant. We have 10 research participants, 2 female and 8 male, and their age from the 20 to 50s, and then period of service used from 3 years to 10 years. And they diagnosed bipolar disorder, schizophrenia, and depression, so on. And the 3 experts were mental health nurses, mental health social worker, voice acting instructor, all female, and their ages from 30s to 40s. Here, I'd like to compare the activities of a Dubbing Project in 2019 without Corona period, 2020, 2021 with Corona activities. In 2019, because of without no Corona, COVID-19 there, so all Dubbing Project performed face-to-face, based on face-to-face program. So at the dubbing class, they met once a week. They script practice, vocal training, dubbing acting practice, and physical exercise for make their voice better. And also field work, variety of field work activities they had. They visited college video system and radio music studio, and also they experienced news anchor, and then music instrument practice, guitar, drum, and singing practice. And also self-help group and summer camp, friendly trip, birthday parties to promote their relationship and connectedness better. So from this face-to-face program of the Dubbing Project in 2019, research participated responded that they have really positive feelings about the project. Also, their friendship strengthened, and also their distance between colleagues reduced. And they had a discussion and empathy sharing, and they actually have some kind of a challenge in their life, and motivation, high level of motivation they achieved. This kind of positive the reaction changed in during the pandemic period in 2020. All face-to-face program stopped. Online program started instead. So dubbing class, online dubbing class, video dubbing class. And also the public relation activities suspended. And then video conferencing, the real-time video conferencing was to communicate each other. But this kind of online activities was not effective because of the home environment was not good to communicate online, and then distance from colleague, and some kind of ambiguity, because in dubbing class, the instructor need to give some guidelines or instruction, but the receiver, not clearly understand what the instructor said through the online, and difficulties concentrating, inability to adapt online. And also at the video conferencing, they had the difficulties, variety of difficulties, such as folder phone. Some of them only had folder phone, and then the many smartphone users not experienced it. Also software program problems and home environment problems, and difficulty in the general communication problems, incorrect pronunciation noise. So 2020 online activities introduced very passively because a lot of barriers, difficulties. So the participants had really negative feelings, and then they back to isolation. In 2021, face-to-face and online program mixed. Dubbing class resumed, face-to-face dubbing class resumed. So they regained energy and a very positive mood, and then more precise practice was possible. And enabling online communication, the on and on training, video training, online feedback. And also they had the idea that how to promote their awareness improvement of the mental disorders. So they tried to use radio internet broadcasting, and they had the online self-help group. And also because of with the corona policy of the government, they went to street to campaign for mental disorder. And video production was the produced, and the YouTube broadcasting, and then their video production used for elementary educational material to further improving awareness of mental disorder. So in 2021, the face-to-face program was operated, and also very active online participation and online activities were performed. So in 2021, compared to 2020 and 2029, the reaction about experience about the dubbing project, the more positively the felt. So expansion of online communication, the also active exchange, daily sharing, presentation, listening, and then radio response, daily 카톡 communication, more connected through on and off meetings. So rather than only all face-to-face program in 2019 and only online program 2020, in 21, both on and off meetings and also communications more effectively related to positive reaction about the dubbing project, and also the people and the participants the more connected, and they more have more friendship, and then they become like a family together. So in staff member also evaluated that because of the online communication, they can share their daily events of almost for 24 hours. They really socially connected and regained their social relationships through the online and the offline meetings, and then classes and all kind of events activities. Here, I'd like to show how the participants actually said about their feeling of experience of a dubbing project. In 2019, dubbing project fun, meaningful time, various activities, and good, wonderful. It was fun going to karaoke, watching movie, and gathering again at night to unite. I think we had a lot of time with them meeting. I don't have any skills while doing radio, but it was really nice to get together, have the kind of experience. I also went to music studio to practice instrument, record a song myself. So they had really fun and very energetic activities in 2019 in face-to-face basis. And 2020 dubbing project, the face-to-face suspended, and the online program started, but was not effective. So the research participants fear isolation again, back to isolation with the corona. Before joining in the dubbing project, their life very isolated with very narrow, limited social connectedness and relationship. But after joining dubbing project, they actually gained motivation and challenges. So they very energetic. They wanted to do something in their life. But because of COVID-19, they had to stay home and disconnected with other people, socially isolated and physically isolated. Then they lose their self-control, self-management. Then they have negative feelings and symptoms. So during 2020 Dublin Project, because of they staying home, not feeling very well, had a hard time. What they said, vacation, rest at home, repeat life, boring. And social relationship deepens, isolation deepens, family strife because they, the home together, some kind of conflict, and then hate each other, and separation from colleagues, and inability to see people. And then they have self-control problems. So get that, what to do, can practice. Negative feelings, stress, a lot of bad things, and also they can remember, lose their memory power, and suspension of service use, stop eating, actually good healthy diet, education, practice, recording of dubbing, and leisure, karaoke, camp, bowling alley. And then also because of this kind of problem, they had to develop their own coping strategies, searching the computer, watching the news, online classes, playing games, walking, exercising, watching nephew growing sprouts. I think the sprouts provided by the institution, so many service users grow their sprouts at home, but was not really though good. So how they respond, how they said about their physical isolation, we'll get weight, we don't even go for walk, you are in rage because of Corona right now, and also we cannot get along with the members. I don't even answer the phone. So the socially isolated. I'm a little cramped at home. I'm trying to find something. It's just life, the repeat itself. I was thinking about what to do, but there are cases where it doesn't work well. So that's why. And negative emotion, symptoms recurrence. I also felt bad at home resting because I can't come to the center. And then they had a lunch at the center, the institution, but now they have to eat at home. So that's another problem. They give rice and side menus at the restaurant, but now it's gone. And the coping strategies, but this is very passive and limited ways of strategies. And 2020 Dubbing Project resumed face-to-face and also online communication activation, introduced. So a variety of ideas related to online program appeared. Even if you are unable to attend the facility due to Corona, you will be interviewed, educated through media videos. I had a heart fluttering. So in 2020, they not adapted to the online the environment, so they hated the online the meeting or online conferencing. But in 2021, they really excited with this kind of experience. And I wanted to spoon radio at home by myself. I thought it was be nice to do it. I promised myself I can talk about I'm doing on YouTube. It's nice to be able to post announcement on YouTube. So they try to use YouTube to promote their, the thought or story, to tell other people their thought and stories. And also they, try the spoon radio, internet radio, and also they memorize the script while pretending to be real, while practicing voice acting. So voice acting helped their voice. They found their own voice. So they wanted to talk more, communicate, and connected to other people, even though radio, internet broadcasting, or YouTube broadcasting. And actually, the online self-help group were very activated. So people said, the participants said they got empathy was formed, and various ideas, opinions came out, sense of belongings they shared. And also after that, we talked about what we felt after doing publicity activity. We set topic of discussion again. So they discussed it a lot, talked a lot on the online self-help groups. And we talked about we felt while doing activities. So they actually heard what others feel about or think. So they listen to others' stories. They understand other people better. We gather ideas, self-help groups, we gather idea of dubbing. So about the work of a dubbing project, they communicate each other. They talk about their fresh, very new ideas about the project. And through the self-help group activities online, know each other better after that. And also they actually wrote the emotional note, so emphasizing with each other. So I felt negative emotions disappear little by little. And I liked dubbing family better. So they think their colleagues and staffs dubbing family. As a dubbing family, I think it feels more affectionate. So this is really important. I can do it. I can do anything. Isn't it obsession? But when I met the place called dubbing, I felt as if those thoughts were gradually disappearing. If I do it next time, if there is opportunity like this, I want to try again. So they gained their self-confidence and self-esteem, and their negative feelings, symptoms gradually disappearing. They're not obsessed much. So this is the summary of experience dubbing project from the research respondents. They think the dubbing project is a kind of a journey of recovery. They restoring their own voice and social relationship. So from the dubbing class, voice training, acting, express practice. This one actually based on face-to-face, non-face-to-face lessons. From this dubbing class, they gain voice recovery, finding one's voice, self-esteem regained. And also group activity was really important because they have to make one production of a dubbing video the cooperatively. So face-to-face, non-face-to-face activities applied from these activities, strengthening social relationship, family relations better, colleagues, they had a friendship, very connected, and they really had a good relationship or work alliance between the participants and staff members. And self-help group affection note through the online non-face-to-face activities. They gained understanding others' empathy, self-care, and sense of self-control reinforced. And human rights education, this is based in the offline, in the classroom, face-to-face education. This is related to they gaining empowerment. So they went to outside on the street to meet strangers, neighbors, citizens, the social contact, because they can improve the community awareness of mental disorder. Through this project, they actually have a competency and skills to explain or tell their story to citizen neighbors. So this is a journey of recovery and restoring their own voice, social relationship, empowerment. So we had this dubbing project for 3 years. In the middle of this project, there is a COVID-19 negatively affected, but later the online the activation was really affected the good, positive, the social relationship or strengthening social relationship. So in conclusion, as I mentioned earlier, in 2019, very positive emotions and spirit of participants challenging. And 2020, no great result due to difficulties. There's a lot of barriers to communicate online at first. So the research participant felt physical, social isolation, problem with the self-management, recurrence of negative emotion and symptoms. And then 2021, voice recovery through face-to-face voice sector training, increased responsibility, collaboration skills by immersion into video recording for a long time, improved the sense of accomplishment as a result of video production, self-control, self-confidence. And then non-face-to-face self-help meetings, on and on education, daily social media communication, sharing to overcome loneliness and isolation, increased solidarity and friendship as daily sharing become easier, and the relationship between colleagues becomes stronger than why only face-to-face program used. Emphasis through self-help meetings and active dubbing and public relation activities by exchanging project ideas, feedback on public relation activities. Here, I'd like to share future consideration for mental health services suggested by scholars and the people in the mental health institutions in Korea. First, expansion of non-face-to-face social services should be considered, such as online content creation provision and support to solve online alienation of clients, strengthen their ability to use them. Urgent need for service development using online and smartphone. So, and then exchange of the perspective of physical space, expansion of on-site service and the space utilization service in the region. So outdoor activities rather than the programs held in indoor. And growing demands for personalized services, small gatherings, a separate program to deal with feelings of emotional isolation, social isolation, and burden. And then strengthening capacity for possible individual family social problems after COVID-19. And corporate bankruptcy due to economic crisis, unemployment, household economic crisis, poverty, and family dissolution, and fear of face-to-face contact, loneliness, depression, death, reclusive loner, and psychosocial problems. And this is very important, establishing a safe net for social workers. They are working in very dangerous situation. And lastly, I'd like to add this, the implication. While the most studies on impact of COVID-19 on mental health services have focused on the position or experience of institutions or social workers or health experts, this study had academic practical implication in that it deals with the user's experience. So because of this dubbing project, conducted for 3 years, in the middle of the project, the COVID-19 affected. So we happened to share and understand the experience of users, the people with mental problems. This is really, really valuable information, we think. Thank you for listening this presentation. Happy New Year.
윤지 교수님 대단히 감사드립니다. 자, 지금까지 모든 발표가 마무리되었습니다. 아마 여러분들께서도 굉장히 의미 있게 발표를 다 듣고 지금 계실 텐데요. 이번 세션에서는 바로 좀 마무리를 지어보는 이번 미국, 스웨덴, 한국을 통해서 우리가 얻었던 경험, 이 경험을 발표해 주셨던 그 내용들이 우리에게 어떤 것을 던져주는지 좀 정리하는 시간을 갖도록 하겠습니다. 이번 세미나의 정리 시간은 저와 박기용 교수님 그리고 임세희 교수님께서 함께 하실 텐데요. 먼저 박기용 교수님 소개해 드리겠습니다.
안녕하세요. 서울사이버대 사회복지대학 박기훈 교수입니다. 오늘 이렇게 의미 있는 또 시의적절한 국제학술대회를 개최하게 돼서 영광이고요. 참여하게 돼서 기쁜 마음으로 있습니다. 감사합니다.
네, 교수님 감사합니다. 그리고 임세희 교수님께서도 함께 자리하셨습니다.
안녕하세요. 서울사이버대학교 사회복지대학 임세희 교수입니다. 만나서 반갑습니다. 팬데믹 상황에 대한 각국의 대응을 주제로 한 본 학술대회에 참여하게 되어 영광으로 생각합니다.
네, 두 분 교수님 자리 함께 해주셔서 너무 감사드립니다. 저 개인적으로는 사실 지난 2년 동안 이 팬데믹이라는 위기 속에 어쩌면 좀 푹 빠져서 어떻게 해야 될지, 어쩌면 좋을지, 무슨 방법을 찾아야 될지 계속 좀 고민했던 시간들인데요. 이번 세미나를 듣고 또 공부를 하면서 오히려 한 걸음 좀 물러서서 한 발짝 뒤에 서서 좀 더 냉정하게 좀 이렇게 침착하게 정말 우리가 앞으로 무엇을 더 찾아봐야 될 것이고 어떻게 대응해야 될 것인가 이렇게 좀 냉정하게 돌아볼 수 있었던 시간이었던 것 같습니다. 뭐 그런 부분에서 이번 세미나 발표에서도 얘기가 되었습니다마는 이 코로나는 태중에 있는 태아부터 어르신들에게 이르기까지 우리 모두의 일상을 살아야 되는 각각의 삶을 우리에게 위협이라는 부분에서 너무 많은 도전을 던져주고 있었고요. 그러한 위험 가운데서 더 큰 어려움을 겪게 되는 분들은 무엇보다 취약한 분들 그리고 사각지대에 놓인 분들이었다는 것은 아마 오늘 스웨덴, 미국 발표 그리고 한국 발표를 통해서 여러분들께서도 공통적으로 좀 공감을 하셨던 부분이 아닐까라고 생각을 합니다. 그리고 역설적으로 좀 이런 위기에 잘 대응을 하려면은 뭐 지금 여러 가지 제도나 정책을 새로 만드는 것도 굉장히 중요하지만 과거에 우리가 예를 들면 사회복지에 대해서 어떤 생각을 갖고 있었고 어떤 사회안전망을 갖고 있었는지 지금 사용하고 있는 정책들에서 우리가 조금 잘못되어 있거나 부족한 부분은 무엇인지 이런 것들을 좀 진지하게 잘 짚어보고 성찰해야 되겠다라는 생각도 열심히 하게 되었는데요. 두 분 교수님은 이 발표 보시면서 어떤 생각하셨는지 제가 참 궁금해집니다. 먼저 박기용 교수님, 네. 이번 세미나가 우리 사회복지 학계 그리고 사회복지 실천 현장 또 나아가서 우리 한국에 대해서 던져주는 메시지는 어떤 점이었다고 좀 말씀을 해주실 수 있을까요?
예, 이번 국제 사회복지 세미나에서 제시된 이 한국, 스웨덴, 미국의 실증 연구 결과는 이 코로나19로 인한 전 세계적인 팬데믹이 이 국제적으로 어떠한 영향을 주었는지를 확인하고 또 비교할 수 있었다는 점에서 큰 의미가 있었다고 생각합니다. 이번 발표를 통해서 코로나 팬데믹과 같은 사회적 위기 속에서 아동, 청소년, 여성, 장애인, 노인 등 이 사회적 취약계층이 더 큰 위험에 노출될 수 있다는 것을 공통적으로 확인할 수 있었습니다. 이러한 결과는 대면 서비스의 제약 혹은 중단, 이 학교, 시설, NPO, NGO, 이 자원봉사 등 지역사회의 사회복지 연계 및 지지체계가 제대로 기능하지 못하는 상황 속에서 나타났습니다. 이 때문에 사회적 약자를 보호하기 위한 정책의 우선순위 선정을 어떻게 해야 할 것인가? 대면뿐만 아니라 비대면을 통한 사회적 연계 및 지지체계 확보를 어떻게 할 것인가 등에 대한 큰 과제가 제시된 것입니다. 또한 이 사회적인 환경 변화 속에서 역량 있는 사회복지 인력을 어떻게 육성해 나갈 것인가에 대한 이 진지한 고민이 필요하다는 것을 확인하였습니다. 저는 비대면을 통한 사회적 연계 및 지지체계 확보, 비대면 교육의 확대 필요성을 이번 국제 세미나에서 제시해 주었다고 생각합니다. 코로나 팬데믹은 비대면 서비스, 비대면 교육의 도입 확대 필요성을 촉진시켰습니다마는 젊은 세대, 지금의 젊은 세대는 디지털에 익숙하다, 그리고 비대면 만남에도 친숙하다는 점을 기억할 필요가 있습니다. 이번 발표에서 소개된 미국의 심팩 프로그램이 있었습니다. 이 심팩 프로그램은 매우 흥미로웠습니다. 심팩은 가상 시뮬레이션을 통한 사회복지사 교육 프로그램입니다. 이 프로그램은 비대면을 통해서도 의미 있는 교육이 제공될 수 있다는 가능성을 보여주었습니다. 앞으로 사회복지는 비대면 교육, 비대면 서비스에 적극적인 대응을 해 나갈 필요가 있습니다. 새로운 커리큘럼, 4차 산업혁명 기술을 활용한 비대면 교육체계 편성, 비대면을 통한 지지 및 연계체계 구축이 필요한 시점이라 생각합니다. 이제 국제 사회복지 세미나의 결과물들을 통해서 우리 사회복지계는 많은 것들을 생각하게 되었습니다. 이번 세미나에서 정말 시의적절한 과제 그리고 시사점을 제시받았다는 점에서 큰 의미가 있다고 생각을 하고요. 마지막으로 이번 발표에 참여하신 모든 분들께 마음 깊은 감사를 드리고 싶습니다. 감사합니다.
네. 저도 정말 같은 공감을 하고 있습니다. 팬데믹이 우리 일상을 바꾼 모습은 너무나 일일이 열거할 수 없을 만큼 굉장히 많은 부분에서 변화를 가지고 온 것은 분명합니다. 그런데 그 과정에서 우리가 그럼에도 불구하고 반드시 지켜야 될 부분이 무엇인지, 이것만큼은 절대 놓지 않아야 될 것이 무엇인지를 구분해내고, 또 하나는 이제 좀 새롭게 바꿔야 할 것은 무엇이고 우리가 변화와 혁신을 해야 될 것은 무엇인지를 찾아내야 한다는 것, 이 두 가지의 숙제가 우리에게 동시에 주어진 어떤 그런 계기가 또 팬데믹이 우리에게 준 하나의 터닝 포인트가 아니었나라고 생각을 하는데요. 임세희 교수님께서도 오늘 세미나 굉장히 집중하셔서 저희들과 함께 보시고 또 공감하시고 연구에 많은 아이디어를 얻으신 걸로 알고 있는데 어떻게 보셨나요?
네, 저는 본 학술대회를 보면서 복지국가 위기 이후 각국의 대응에 대한 학문적 연구가 광범위하게 이루어졌듯이 향후에는요, 코로나19에 대한 각국의 대응이 복지국가 유형과 각 복지제도 그리고 사회복지 대상에 따라서 어떻게 달랐는지, 그리고 각기 다른 대응이 각 나라의 사회 통합과 불평등에 어떤 영향을 미쳤는지에 대한 연구가 굉장히 활발하게 이루어지지 않을까라는 생각을 하였습니다.
네, 대단히 감사합니다. 제가 지금 이 종이 원고 같은 종이를 들고 있는데 바로 이 2시부터 지금 4시 10분 조금 못 됐는데요. 이제 우리 세미나를 진행하는 동안 참여해주고 계시는 여러분들께서 유튜브 실시간 채팅창을 통해서 남겨주셨던 내용들을 지금 막 정리해서 이렇게 받았습니다. 그래서 두 분 교수님도 아마 받으신 걸로 알고 있는데 이렇게 보다 보니까 제가 좀 인상 깊어서 잠깐 언급을 좀 하고 넘어가야 될 것 같아요. 그래서 코로나를 경험하면서 장기 요양, 청소년, 장애인, 정신건강 이런 모든 부분에 이제 과제를 정리하는 계기가, 이 코로나가 차라리 그런 계기가 되었으면 좋겠습니다라고 말씀해 주신 분들이 굉장히 많으십니다. 그리고 팬데믹 상황에서 이번 세미나를 통해서 사회복지계가 어떤 어떤 쪽에 조금 더 무게중심을 잡아야 할 것인지 고민하게 되었다라는 취지로 또 많은 말씀을 해 주셨던 것 같아요. 그래서 임세희 교수님, 같은 지금 내용 코멘트 보고 계시는데 좀 의미 있었던 부분들 한번 짚어 소개해 주시겠어요?
네네. 저는 여러 코멘트 중에서 김경직 관장님께서 남겨주신 코멘트가 인상적이었는데요. 김경직 관장님께서 저희도 긴급 돌봄의 서비스만 제공되었습니다. 사례관리에서는 당사자의 방문이나 전화 상담이 매우 확대되었고 정서적 우울감을 해결하고자 하는 다양한 프로그램 등이 기획 제공되었습니다라고 남겨주셨는데요. 우리 사회복지계도 다른 국가와 마찬가지로 코로나19 처음에는 혼돈을 경험하고 기존 서비스를 멈췄던 것 같습니다. 하지만 많은 사회복지사들이 자신들의 사회적 책무를 다하고자 이 상황에서 우리가 할 수 있는 것을 찾고 어떻게든 그것을 해결하고자 노력했던 점을 말씀해 주셔서 굉장히 감사하게 생각했습니다.
네. 그런 부분에서 또 코멘트를 남겨주셨네요. 박기훈 교수님도 아마 실시간 코멘트 정리한 내용을 지금 보시는 것 같은데 교수님 어떤 부분에서 좀 인상적인 부분들을 보셨나요?
예, 많은 분들이 굉장히 의미 있고 또 재미있는 코멘트를 남겨주셨는데요. 제가 보았을 때 저에게 좀 의미가 있게 다가왔던 코멘트 몇 가지를 읽어드리도록 하겠습니다. 주로 샘 버나디노 교수님들이 발표하신 그 발표 내용에서 올라온 내용들이 저에게는 좀 의미 있게 다가왔는데요. 먼저 김은혜 님이 작년에 실습을 해서인지 다른 나라도 많이 힘든 와중에 교육을 놓치지 않으려고 노력하는 모습이 보이네요 라고 코멘트를 남겨주셨습니다. 자, 작년에 실습을 했다면 참 어렵고 힘든 시기에 실습을 해서 이 실습 기관을 찾는 것이 얼마나 어려운 것인지 잘 알고 계실 거라고 생각이 되고요. 또 서울사이버대 글로벌 자격관리센터 그리고 실습 교수님들이 정말 열심히 실습을 준비하고 또 실습 기관을 충실한 실습을 위해서 노력하는 모습들이 정말 눈에 선하게 기억이 나더라고요. 그래서 아주 의미 있게 다가왔고요. 그 다음에는 I love KKA3312님이 이와 같이 코멘트를 남겼습니다. 사회복지 분야는 팬데믹에 아직도 대응이 부족한 곳이 많은 것 같아요. 예, 맞습니다. 새로운 위기 상황 속에서 발빠르게 대처하기가 쉽지는 않습니다. 그러나 우리가 이와 같은 국제 학술 대회를 통해서 또 여러 가지 연구들을 통해서 앞으로의 미래를 대응해 나간다고 하면은 앞으로 어떤 어려운 상황이 온다 할지라도 그 부분에 대해서 적절하게 또 효과적으로 대처해 나갈 수 있을 것이다라고 생각을 합니다. 그런 의미에서 서울사이버대에서 공부하는 여러분들에게도 큰 책임이 주어진 것이 아닌가라는 그런 생각을 해보게 됩니다. 자, 그리고 또 김은혜 님이 또 한 번 코멘트를 남겨주셨는데요. 저에게는 인상적이었습니다. 가상 서비스 프로그램이 개발되면 현장도 학생들도 서비스를 제공받는 분도 너무 좋을 것 같아요 라고 이렇게 코멘트 남겨주셨습니다. 저는 비대면 서비스 그리고 비대면 교육이 앞으로 확대되지 않을까라고 생각을 합니다. 4차 산업혁명의 기술들을 활용해서 대면 서비스 못지않은 그런 비대면 서비스도 상당 부분 가능하지 않을까라고 생각을 합니다. 자, 그리고 이 팬데믹 상황에서 사회복지사를 교육하는 것이 굉장히 어려웠습니다. 또 사회복지사가 실습을 나가는 것도 굉장히 어려웠거든요. 이제 그런 부분들을 비대면 교육을 통해서 역량 있는 사회복지사를 육성해 낼 수 있는 그런 가능성을 이번 팬데믹을 통해서 우리가 볼 수 있지 않았는가라는 생각을 하고 있고요. 많은 가상 서비스 프로그램, 미국의 심팩이라고 하는 것도 제가 말씀을 드렸는데요. 그와 같은 가상 시뮬레이션 프로그램들이 더 많아지면 많아질수록 충실한 비대면 사회복지 교육이 가능해질 것이다 라고 생각합니다.
네, 감사합니다. 자, 팬데믹은 우리에게 공간에 대한 생각을 좀 많이 바꾸게 되는 그런 여러 가지 계기를 좀 준 것 같습니다. 다름 아니라 물리적인 어떤 장치, 어떤 시설 이런 것들을 넘어서고 또 그 공간이라는 것은 또 넘어서야만 한다라는 생각을 한번 하게 해준 것 같기도 한데요. 말하자면 장기 요양시설 같은 경우도 이 분명히 돌봄과 주거가 함께하는 공간으로서의 어떤 안정성이라던가 기능이 분명히 담보돼야 될 것이고, 또 뭐 이거는 비단 그 장기 요양뿐만 아니라 각종 사회복지시설, 그룹홈도 마찬가지일 것입니다. 그리고 우리 한 사람 한 사람이 살고 있는 가정도 마찬가지일 것이고요. 그래서 이번 발표에서도 뭐 대학, 그리고 일터, 장기 요양시설, 그룹홈, 가정폭력 피해자 보호시설 등등 각종 우리가 중요하게 생각하는 공간과 관련되어서 이 팬데믹이 우리에게 어떤 화두를 던졌는지 이와 관련한 언급들이 굉장히 많이 있었는데요. 과연 사회복지에서 이 공간이라는 관점을 어떻게 좀 더 잡아야 할 것인지, 과연 우리는 팬데믹을 겪으면서 공간, 그리고 주거, 인간다운 삶이라는 주제를 이 사회복지 분야에서 어떻게 잘 적절하게 조화시키려고 노력했는지, 이런 부분들도 좀 함께 생각해 봐야 될 것 같은데, 특별히 임세희 교수님 이 부분에 대해서 좀 많은 생각을 하시면서 세미나 들으셨던 것 같아요. 조금 정리 한번 해주시면 어떨까요?
네, 중요한 질문 감사합니다. 팬데믹은 우리에게 각자의 집으로 돌아가서 머무를 것을 요구하였습니다. 하지만 그 집이 머무르기에 적절한 집이지는 고려하지 않았습니다. 아동들은 집에서 공부하고 놀아야 했지만 어떤 아동들은 자기 책상은 물론 책 몇 권조차 공간이 허락되지 않기도 하였습니다. 낡은 디지털 기기, 느린 인터넷 환경에 노출되어 있었지만 그 모든 어려움은 아동 개인에게 내맡겨 주었습니다. 일부 시설 아동도 원격 수업을 하기 어려운 것은 마찬가지였습니다. 아동복지법상 아동복지시설은 1실 3인 사용을 원칙으로 합니다. 책상에 대한 규정도 없습니다. 방문해 보니 자기 책상이 없고 공동으로 사용해야 되는 경우 아이들은요, 침대에서 스마트폰으로 원격 수업에 참여하고 있었습니다. 또 확진자나 밀접 접촉자가 발생하였을지 격리할 수 있는 공간이 없다 보니까 코호트 격리를 우려하여서 우리가 마스크를 쓰고 허용되었던 많은 활동들을 일부 시설 아동들은 아예 허락받지 못하였습니다. 팬데믹은 비대면 서비스, 가상 공간의 활동을 강조합니다. 그러나 이는 역설적이게도 실제 공간, 실제적 환경의 중요성을 보여주었습니다. 실제 공간, 실제적 환경이 기본적으로 갖추어져 있어야 감염병 예방도, 가상 공간의 목표도, 가상 공간의 활동의 목표도 우리가 달성할 수 있습니다. 다시 말해 사회 취약 계층의 실제적 환경에 개별적으로 관심을 가지고 개입해야 합니다. 찾아보니 영국에서는요, 사회복지사가 원격 수업을 따라오기 어려운 아동을 학교와 협력해서 확인하고 개입하고 있었습니다. 팬데믹이 불평등에 미치는 영향은 본 학술대에서도 드러나듯이 기존의 제도와 사회 환경에 따라 다릅니다. 언제든지 반복될 수 있는 팬데믹 상황에서 사회 취약계층의 기본권을 보장하고 사회 연대성을 지향하는 우리 사회복지사들은 무엇보다도 팬데믹 상황에서 사회 취약계층의 경험을 확인하고 목소리에 귀를 기울여야 할 것입니다. 모든 사람의 물리적, 사회적 환경, 즉 실제적 환경에 보다 개별화된 관심을 가지고 그 개선을 위하여 여러 학문, 실천 분야가 함께 노력해야 되지 않을까, 그런 생각을 하였습니다.
네, 교수님 말씀 대단히 감사드립니다. 자, 지금 시간이 4시 17분여를 조금 더 지나가고 있는데요. 이제 이번 세미나가 모두 마무리되었습니다. 마무리를 향해서 가고 있습니다. 사회복지를 공부하고 또 사회복지를 실천하고 이 분야에 있다 보면 자꾸 우리나라의 사회복지, 우리나라 사회복지 교육, 또 우리나라 사회복지 안전망 이런 쪽에서 계속 고민하고 이것을 들여다보기 때문에 이 한 국가에 굉장히 좀 깊이 있게 들어가게 될 수밖에는 없는데요. 저는 이번 국제 세미나를 통해서 우리나라가 행복하기 위해서라도 또 우리가 미래 세대와 더불어 같이 함께 약속할 수 있는 삶을 꿈꾸기 위해서라도 지구촌에 함께 살고 있는 시민들이 같은 문제에 같은 관심을 가지고 우리가 인간다운 삶이라든지 이 행복한 어떤 그런 웰빙을 위해서 애를 써야 되겠구나라는 생각을 많이 하게 되었습니다. 그리고 궁극적으로 이 팬데믹과 위기가 우리에게 도대체 무엇을 얘기해주고 싶어 하는지, 그리고 과연 우리가 해결해야 될 중요한 영역들은 무엇이고 그 영역들 가운데서 우선순위를 어떻게 잡아가야 할 것인가, 이러한 점에 대해서 좀 이번 세미나가 많은 것들을 공부하고 연구하고 또 한 번쯤 고민해야 된다는 그런 얘기들을 저희에게 또 여러분들에게 끊임없이 해주었던 그런 계기가 아닌가 싶습니다. 자, 신년 1월 7일 금요일 오후 2시에 시작을 했는데요. 이 신년에 분주하고 또 여러분들 저마다의 계획을 세우고 현업에서 이렇게 생활을 하시는 가운데서 이 시간에 자리를 함께 해주셔서 정말 대단히 감사드립니다. 여러분들께서 관심을 가지고 함께 뜻을 모아주신 덕분에 아마도 지금 이 팬데믹이라는 위기가 우리나라 전체를 좀 다소 어둡게 하고 있지만 이러한 관심들을 모아서 우리가 노력한다면은 또 올 한 해 2022년은 새로운 희망과 또 새로운 성장을 할 수 있는 도약이 될 수 있을 거라 생각합니다. 자, 지금까지 서울사이버대학교 사회복지대학에서 2022년 SCU 국제사회복지 세미나를 진행하였습니다. 참여해주신 모든 분들께 대단히 감사드립니다. 새해 복 많이 받으십시오. 감사합니다.